Hi, I'm Steve Hebrock. I know horse owners are greatly concerned anytime the veterinarian or hoof care provider uses the word navicular. And there's been a fair amount of interest in my very brief talk on the subject as part of my recent A Few Minutes video series, so I thought I'd spend a few more minutes trying to help viewers sort out some of the confusion surrounding this subject. Now, the good news is that although a diagnosis of navicular is extremely common, in my experience, it's nearly always incorrect. And I personally believe it's the most misunderstood and misdiagnosed condition in the entire equine world. So first, let's talk about a bit of anatomy and biomechanics so we're all on the same page with regard to exactly what we're talking about. This is a coffin bone, also called the pedal bone or P3, and it's the horse's foot bone. At the back of the coffin bone and attached to the bone with several strong ligaments is this rather small bone called the navicular bone, which is one of three so-called sesamoid bones in the horse's lower leg. Now, sesamoid bones aren't really weight-bearing bones in the usual sense. Rather, their function is to redirect the motion of tendons. In the case of the navicular bone, it functions as a pulley for the deep digital flexor tendon. This tendon comes down the back of the leg and wraps around the back surface of the navicular bone before connecting into the bottom center of the coffin bone. And it's responsible for rotating the foot towards the back of the horse. By wrapping the tendon around the navicular bone, the tendon is always pulling on the coffin bone from the same direction, regardless of the angle of the pastern bones above it. So there's the necessary background information. Now, there are three words or phrases the vet or farrier uses that contain the word navicular. There's navicular syndrome, simply navicular, and navicular disease. The first two are not a description of a disease. They're only a description of a symptom. When a horse is experiencing pain that seems to be or is coming from the back part of the foot, what's called caudal foot pain, and the vet or farrier has no idea why or what the exact origin of the pain is, he or she will often label it as navicular or navicular syndrome. But frankly, it's an essentially useless description because it doesn't convey any useful information. It just means the horse hurts seemingly somewhere in the back part of his foot. On the other hand, navicular disease is a very real disease with a very definite etiology with damage to a very specific region of the foot. And that region is the back face of the navicular bone where the flexor tendon crosses it, and the opposing face of the tendon itself. When a horse makes repeated hoof landings that are not consistent with the design of the horse's foot over a long period of time, and especially at higher speeds, then damage occurs to the navicular bone and the deep flexor tendon. You know, we do things with our horses that nature never intended them to do, and some of those things cause damage. And as I said, in this disease, the damage has a very specific form, and this damage is permanent. It can't be fixed. There isn't a pill or a supplement, there's no injection, no PEMF therapy, nothing that will cure this condition. Just like if a person wears out her hip or her knee, the only fix for that is to replace the joint, which unfortunately we just can't do with a horse. So if a horse truly has navicular disease, it's permanent. And if someone tells you his or her horse had navicular disease and was cured, then that was flat out a bad diagnosis. The horse did not really have true navicular disease. Now that's actually the good part of this whole thing. As I mentioned at the start, this disease isn't well understood by most vets or farriers, and in nearly every case, the diagnosis of navicular disease is incorrect. In my experience, and I've seen a lot of horses in 30 years with this diagnosis, it's usually one of three things causing the pain. a bad bacterial infection in the central sulcus of the frog, a soft tissue injury of a tendon or a ligament, horses pull things, or long heels on a horse that's worked on hard ground, especially if the horse is shod, because shoes increase the concussive forces on the foot and short-circuit much of the shock-absorbing ability of the foot. So how do you sort this out? Well, there are a few things you need to know. First of all, because true navicular disease is caused by overuse and misuse, it takes quite a while to develop. As I mentioned, it's a very specific form of damage to both the navicular bone and the deep flexor tendon where the two cross. It's most definitely not holes or invaginations, what the vets will often call lollipops, in the navicular bone. Those holes are not a symptom of navicular disease. And right along with that, it's important to understand that in all but advanced cases, the damage of navicular disease will not show up on a radiograph because it starts out as soft tissue damage that doesn't image on an X-ray. So if your vet's pointing to holes in the navicular bone on a radiograph and telling you your horse's pain is navicular disease, he or she is mistaken. The only conclusive test for navicular disease is an MRI. But you can assess the probability of your horse having or not having navicular disease by considering your horse's history. Short of an MRI, that, in my opinion, is the most powerful and useful diagnostic tool for navicular disease at your and your vet's disposal. There are some definite factors, things your horse has or hasn't done, and symptoms your horse is or isn't showing that figure into tipping the scales either towards or away from a logical diagnosis of navicular disease. Let's first talk about the symptoms. Given the kinds of activities that can cause navicular disease, it's almost universally a disease exhibited in both front feet, not in a single foot and not in the hind feet. It's also an on-again, off-again sort of lameness with the horse demonstrating a shortened stride. And you'll see horses with this disease often point. They shift their weight back and forth from one front foot to the other. So if your horse's symptoms aren't consistent with these, it's likely not navicular disease. Also, again talking about how this disease has a slow onset, much like hearing loss or heavy metal poisoning, it's certain long-term repeated activities that cause this disease. Because it's directly connected to improper hoof landings, especially at higher speeds, horses that have done a lot of show jumping and horses that have been routinely worked at higher speeds on pavement or hard ground, especially if shod, and especially if landing heel or toe first. Those are the horses most at risk for developing true navicular disease. So that means if your horse is fairly young and or done only trail riding or worked at higher speeds only in a sand arena, he's very unlikely to have navicular disease, and you need to look elsewhere for the cause of his pain. So history matters, and recognizing the symptoms of navicular disease combined with understanding what activities contribute to the formation of navicular disease should equip you to sort out whether or not it's likely in your particular situation. I do want to leave you with one very important thought. Since you now know that navicular disease is caused by improper hoof landings, hopefully you'll understand when I say that the standard treatment for navicular horses of wedging up the heels is absolutely the worst thing you can do for a horse with suspected navicular issues. If this is a subject of real interest or concern for you, maybe, for example, you'd really like to understand why improper hoof landings damage the navicular bone and deep flexor tendon, consider coming to one of our Hoof Care for Horse Owners workshops. We cover this subject in depth, and you can even schedule a personalized consultation during the workshop to help you sort out your specific situation. Thanks for listening.